Hello, my name is Ochije. I'm a fourth year medical student at OSU CHS. I'm here to present our research entitled Use of Behavioral Change Taxonomies in Systematic Reviews and Meta-Analyses Regarding Obesity Management. This work was published in Clinical Obesity in December of 2022. Obesity is a complex and multifactorial disease that remains one of the leading causes of preventable death worldwide. There have been many studies to determine the most effective interventions for obesity. However, the principles of these interventions should be standardized such that replicable techniques can be used to improve patient outcomes. We investigated the prevalence of behavioral change taxonomies in systematic reviews and meta-analyses related to obesity management. In addition, we analyzed funding sources, conflicts of interest statements, risk of bias, and favorability of the results in such studies to determine if there was a relationship between the methodological quality and taxonomy use. To conduct the study, we searched several databases including Medline, Epistamonikos, Cochrane, PubMed, and Embase for systematic reviews and meta-analyses regarding the behavioral treatment of obesity. Screening and data extraction was performed in a masked and duplicate fashion. We performed statistical analyses to determine any significant association between use of a taxonomy and study characteristics. We showed a flow diagram here for the inclusion of studies. We ended up with 186 articles. The results were that 15 of the 186 articles used a taxonomy. 9 of those were the BCTT version 1 taxonomy. 3 of those 15 articles used the Oxfab taxonomy. 2 used the calorie taxonomy, and 1 use taxonomy of choice architecture techniques. Most interventions that referenced the taxonomy were self-mediated. Behavioral change taxonomies were mentioned in 10 studies with a public funding source. Of the studies with favorable results, 14 studies referred to a taxonomy. We found no statistical significance between taxonomy use and study characteristics. Here we show a table of some of the study characteristics that we extracted, such as the type of intervention, whether it be city or government, or self-mediated, which was most common, whether it was a technological intervention. Also, we show the favorability of results, whether it was favorable, unclear, or unfavorable for the technique. We show here the funding source as well, whether it was hospital, public, or university funding. And so those are just some of the study characteristics that we extracted. And so in conclusion, we found that systematic reviews regarding the management of obesity rarely mention a behavioral change taxonomy. Given the global burden of obesity, it is crucial that behavioral change techniques are reproducible and translatable. So we recommended that researchers look further into how taxonomies affect the reproducibility of behavioral interventions to strengthen the methodological quality of research and improve patient outcomes. And for our acknowledgments, we wanted to thank Courtney Kennedy, our systematic review librarian, for conducting our search. And thank you for your time.